welcome to another episode of Ask the Healthcare Advocate Live. Today I'm going to talk briefly about boundaries for ourselves and for the people that we are caring for, and how do those ideas of boundaries fit into advocating for ourselves and this sort of relentless pursuit of something, whether it be a imaging test or a treatment or a doctor or a set of or a long-term care plan, whatever it is, how does that go about with the pursuit of that? So first, I need to clarify something that I had a number of clients this week who I've basically been battling with, not with them, but with the system. And I use the word battling on purpose for Bituach Leumi, for the National Health Insurance. Three of them who really were, I knew that they were eligible for disability rights, and for whatever reason, they hadn't received them. And basically, it was almost between half a year and a year of pursuit, and they all received their disability rights. They received the stipend. But what was interesting in that is that some of the families of the clients were less than positive and felt that we should just, well, that's how it is. We're going to give up. They're not going to be eligible. We're going to move on. And I said, no. I said no, and I said no, and I said no. And why did I do that? Was because I knew that they were eligible. I knew the law. I knew the criteria. I knew where their status was. And I think that's one of the first important things that you have to decide is, first of all, you have to know that this is the thing that is correct for you. So it could be a stipend, it could be a government benefit, it could be a doctor. You've done your research, you've spoken to people, you know that this doctor is the expert in this particular issue, but you can't get an appointment or you can't get it covered, whatever it is. When you know that this is the option for you that is going to serve you best, and I'm not saying that that's easy, but when you know for whatever reason, then when you're advocating for yourself or when you're advocating for others, you need to just keep going forward. Because unfortunately, somehow how the system is set up, not necessarily to bring everyone the health care that they are eligible for or the service that they are eligible for. And there are mistakes that are made. There are overlooked aspects. There are tired workers. There are people who don't want to put more than 35 seconds in a review. There's an annoyed secretary. There's an overworked doctor. Whatever it is, there are going to be lots of barriers in the way that are not there because the universe is telling you that isn't the right service for you. It's because that those are just the blocks that you need to get through in order to get the service that you need. So when you figure that out, and it can't be everywhere because otherwise you will exhaust yourself, but when there is something that you know that you are eligible for, then you have to keep the blinders on and you have to keep focused. And no matter what other block comes in your way, you have to be creative. You have to just think it anew and say, like, okay, we're going to try it again this way. We're going to try it again that way. We're going to try it again that way. And that is what you need to do in today's healthcare system. That being said, we also make sure that we have to protect ourselves and those that we care for. So when there is something that is not sure, or it's like somebody mentioned to us that maybe this could be a good treatment for us, but it's not working out and we're not sure about it, and there's another alternative, then that might be the time to say, okay, I've done my due diligence, or this is not the thing for me, and now I am going to move on to this other direction. This is also how boundaries come into play. So, for example, when we are pursuing something as a doctor's appointment, let's say, you can call the secretary every day. It doesn't matter if she gets a little bit irritated with you. What you cannot do is call the doctor every day. You cannot call somebody at their home. You cannot accost somebody in an aggressive or inappropriate way. You cannot yell at somebody in the hallway. However, you can wait outside a doctor's door in the hospital if they are not responding to you, and wait till they come out and then go up to them and say, I've been trying to get an appointment with you, or et cetera, et cetera. You can do those things. Sometimes it's a little bit, the boundaries can be a little bit blurred, but most importantly for you are the emotional boundaries. If you feel that you are the person who is sick, and you are advocating for yourself, and you feel depleted from whatever action you are taking, you have to get help. You have to get somebody else to come in to help you, because that is not where you want to be. Or you have to stop. If you can't get the help, stop, take a breather, rest for a month, let's say, and then try it again. So it is this very strange combination of tenacity and boundaries, balance and not balance. And yes, that is the strange paradox with which we live when we were involved in the healthcare system and advocating for ourselves. And we can't let it go. We cannot let it go, because that is how things work, and we need to get the healthcare that we need to get. So I hope that was a little bit helpful in this gray morning. That isn't raining yet, but it's a little gray outside. I hope it brings a little spark of sunlight into your morning. And join us every Sunday morning between 8:30 and 9 when we talk all things healthcare advocacy. Any questions, as always, please send me a private message or a comment below. And happy to answer your questions. Thanks for joining us.